My name is Monica Huberts, and I am a board member for the Northeast Ohio Crohn's and Colitis Foundation, as well as the Take Steps committee member. Thank you all for joining us tonight for this virtual Ask the Doc event. I'd like to first start off by having each of you briefly introduce yourselves, and then we'll move on to the questions for the evening. So if Dr. Katz, you'd like to start?
Yes, hi. I'm Jeff Katz at University Hospitals Cleveland Medical Center, and I take care of patients with inflammatory bowel disease for now over 25 years here.
Hi, I'm Jessica Philpott. I'm another medical gastroenterologist, and I also participate in the care of many patients with IBD as well.
Hi, my name is Vibhu Chittajalu. I'm a third-year internal medicine resident at Cleveland Clinic, and I'm in the process of applying for gastroenterology fellowship.
Thank you. We also have another doctor, Dr. Taha Kazi, who's offline, but is also answering some of our questions.
Hi, my name is Taha Kazi. I'm an associate staff at the Cleveland Clinic who specializes in the care of patients with inflammatory bowel disease.
So if we could start here, I'd like to start with Dr. Kazi. What is your advice to patients nervous about going on or switching biologics during a time when compromised immune systems are at a forefront of everyone's minds?
So these are clearly unprecedented times, and the main advice that I have for patients who are about to start a biologic therapy in these times of COVID is that none of our agents in the biggest study have been shown to increase patients' risk for COVID-19. These include agents like TNF antagonists, Remicade, Humira, but also agents like Entyvio, vedolizumab, or Stelara. And I think the reason for that is that a lot of these agents are quite specific in the way to sort of mount a defense against the inflammatory bowel disease, and are probably not the reasons patients are catching COVID-19. Now, once again, these are small studies, the largest study being about 500 patients with inflammatory bowel disease, but I tend not to put patients at risk of having a flare by holding medical therapies from them. I try to vaccinate them and try to provide them good counseling on hand hygiene and health hygiene in these times of COVID-19.
Thank you. And Dr. Chittajalu or Dr. Katz, maybe you guys could answer this next question regarding emergency room visits. What can you ask from your GI to make ER visits an easier and more efficient or beneficial process? Oftentimes, ER visits for dehydration and pain management go untreated due to this disease being somewhat invisible.
So I think the main thing is try to stay out of the emergency room, if at all possible. So if you don't feel well, contact your physician's office, ask for a callback with either usually it's the physician's nurse or nurse practitioner or associate, or sometimes the physician if they're available, and try to determine whether it's really appropriate to go to the emergency room. Patients with inflammatory bowel disease have chronic symptoms. They have chronic diseases, and those symptoms can wax and wane. And you're going to get the best care possible if you try to keep your care within your IBD team rather than using the emergency room.
I think the first thing to recognize is to kind of be patient with us because you're new to us. So as far as your previous medical history, we may not be familiar with it. So I think it's very important when you're coming into the emergency room, first off, clarifying, yes, you do have this history of IBD, whether it's Crohn's or ulcerative colitis. I think it's worthwhile to know your history of medications, what you're currently on versus what you've previously been on. If you've ever had a surgery before, it's very good to know that. And then the bigger thing is understanding the chronicity of your symptoms. So are you presenting due to significant nausea? Is it due to abdominal pain? The number of bowel movements you're having, are you having bloody bowel movements? Are you having fevers? All of these things are very helpful for us to try to gauge, is this a complication of your Crohn's or ulcerative colitis? Are you having a flare? Is this an infection? Or is this something more significant like a perforation that would require surgery? So all of these symptoms, I think it's worthwhile to think about when you're presenting to the emergency department, having a good understanding of your medical history, in addition to what's happening more acutely as far as why you're presenting, because this will help us further both manage it and further evaluate it with labs and imaging.
Thank you.
And I think just one thing to add, having a wallet card that has all of your medications, your allergies, what your diagnosis is, any surgeries, sometimes can save a lot of time because they're going to ask you the same questions many times.
Thank you. And our last question for tonight is for anyone who would like to answer. What is your best advice on managing stress during this difficult time and also during a flare?
Oh, I guess I'll start. I bet we all have some advice, but I think knowing yourself and giving yourself a break is important. Sometimes when we're stressed out, then we get upset at ourselves for being upset. And especially if you have IBD, people become worried that that's going to provoke a flare. So they're like, so worried that they don't want to get stressed, yet then it's stressful trying not to be stressed. Exploring different ways to deal with stress. Every person's going to have a different way to do that. And I'm sure my colleagues have some thoughts about that, but some people meditate, some people exercise, some people watch, silly TV shows.
Completely agree with Dr. Philpott. I think this one thing this is considering is just with the current COVID-19 situations and the social isolation, I think it's worthwhile to make sure that you're discussing with your family and friends if you are having stress, to make sure to at least make sure you're not keeping that in and discussing with others, and then thinking about things that do make you happy.
I think I'll just add in one comment that to date, it relates to the coronavirus infection, which obviously is part of what the question is about. To date, really the important thing is taking care of your inflammatory bowel disease, because there's no evidence that the medications that we're using to treat your disease make you more likely to get coronavirus infection or to have a more severe coronavirus infection. So it's really important to understand that just because you have IBD does not mean that you're necessarily going to get coronavirus or get a severe coronavirus infection. So please keep taking your medicines and, social distance and wear a mask and wash your hands.
Thank you guys so much again for participating tonight. Is there anything else you'd like to say to your patients particularly, or other patients in Northeast Ohio?
Thanks for logging in, and we're so excited that you're participating with Take Steps. So
Keep supporting Crohn's and colitis, because eventually we'll get there. We'll get to a cure for these illnesses.
Great. Thank you guys so much.
Take care. Bye.
Bye.
thank you.
Thank you.